Welcome back. In this video, we're going to work through several practical case-based projects related to depression care. These exercises will help you apply your knowledge of long-term management, follow-up care, and addressing treatment resistance in real-world settings. We'll develop a long-term care plan for a patient with recurrent depression, create a follow-up schedule for patients with resistant depression, and use problem-solving therapy exercises to address a case where depression symptoms are not improving. Lastly, we'll practice role-playing a session where we reassess the diagnosis and adjust the treatment plan for a patient with treatment-resistant depression. Case 1. Developing a long-term care plan for a patient with recurrent depression. Let's begin with a case where we need to develop a long-term care plan for a patient with recurrent depression. Imagine you're working with Rachel, a 40-year-old woman who has experienced 3 depressive episodes in the past 5 years. She has responded well to antidepressants, but she is still at risk for future episodes. Step 1. Monitor symptoms and medications. Rachel's treatment plan should include regular follow-up appointments every 3 to 6 months to monitor her symptoms and medication adherence. Even though her depression has been in remission, it's crucial to assess any subtle changes that could signal an impending relapse, such as a drop in energy or mood. Step 2. Continue medication. Given Rachel's history of recurrent depression, she may benefit from maintenance therapy with an SSRI or SNRI to prevent a relapse. It's essential to discuss the importance of staying on medication even when she feels better, as this can help maintain stability and prevent future episodes. Step 3. Ongoing psychotherapy. In addition to medication, Rachel should continue therapy, particularly cognitive behavioral therapy, CBT, to help her build coping strategies and resilience. Regular therapy sessions will also help her address stressors and manage potential triggers that could lead to a future depressive episode. Step 4. Lifestyle modifications. Encourage Rachel to maintain a healthy lifestyle, including regular exercise, a balanced diet, and adequate sleep. Lifestyle changes are crucial in maintaining mental health over the long term and can help reduce the risk of relapse. Reflection questions. How can monitoring symptoms and medication adherence help prevent relapse in patients with recurrent depression? Why is ongoing psychotherapy important for patients with recurrent depression, even when they feel better? Case 2. Creating a follow-up schedule for patients with resistant depression. Now, let's discuss follow-up care for patients with resistant depression, those who have not responded to initial treatments. Take John, a 38-year-old man who has been on antidepressants for 6 months, but his symptoms have shown little improvement. He is also undergoing CBT, but he still feels hopeless and unmotivated. Step 1. Frequent follow-up appointments. For patients like John, who have treatment-resistant depression, follow-up appointments should be scheduled more frequently, perhaps every 2-4 weeks initially. During these visits, you will assess whether the patient has experienced any changes in symptoms, discuss any side effects of medications and whether they are impacting adherence, consider whether additional therapies or interventions are needed. Step 2. Evaluate treatment plan and make adjustments. If the patient shows little progress, consider adjusting the treatment plan. This could involve switching medications to a different class, e.g., SNRIs, TCAs, or MAOIs. Introducing adjunctive therapies such as mood stabilizers, antipsychotics, or ketamine for severe cases. Increasing therapy sessions or trying a different type of therapy, e.g., dialectical behavior therapy, DBT, or interpersonal therapy, IPT. Reflection questions. How often should follow-up appointments be scheduled for patients with resistant depression? What adjustments can be made if a patient is not responding to initial treatments? Case 3. Problem-solving therapy exercises. In this case, we're working with Sarah, a 29-year-old woman who is experiencing worsening depression despite being on antidepressants and attending therapy. Sarah is feeling overwhelmed by life's demands, including work stress and relationship difficulties. We'll apply problem-solving therapy to help her break down these challenges. Step 1. Identify the problem. Start by having Sarah identify the core issue causing her depression. Is it work stress, relationship problems, or another external factor? For Sarah, she feels overwhelmed by work, and she believes her depression is getting worse because of it. Step 2. Brainstorm possible solutions. Sarah and the therapist should brainstorm possible solutions to address the work-related stress. Some ideas might include setting boundaries with her manager or colleagues to manage workload, delegating tasks, or asking for help with responsibilities, exploring stress management techniques, such as time management or mindfulness. Step 3. Develop an action plan. Once solutions have been identified, Sarah can create an action plan to tackle the stress. For instance, she might start by setting small, achievable goals, such as having a conversation with her manager about workload, or setting aside time each week for self-care. Reflection questions. How can problem-solving therapy help a patient manage external stresses like work or relationships that contribute to depression? What role does goal setting play in coping with depression? Case 4. Role-playing scenario. Reassessing diagnosis and adjusting the treatment plan. In this role-playing scenario, we are assessing a patient, Alex, a 40-year-old man with treatment-resistant depression. He has been on antidepressants for over 6 months, but still feels very low and is not responding well to CBT. We will reassess his diagnosis and adjust the treatment plan. During the role-play, you will ask Alex about his current symptoms and how they've changed or not changed. Any stresses in his life that may be contributing to his depression. Whether he has experienced any side effects from the medication. Explore alternative therapies or medication options that may better meet his needs. Once you have gathered the information, adjust the treatment plan by either changing medication or adjusting the dose. Adding adjunctive treatments like mood stabilizers or antipsychotics. Increasing the frequency of therapy or exploring different therapeutic modalities. Reflection questions. How would you reassess the diagnosis for a patient with treatment-resistant depression? What factors would you consider when adjusting the treatment plan for a patient who is not responding to initial treatment? Embedded knowledge quiz. Now, let's test your knowledge with an embedded quiz. Question 1. Which of the following is the first step when addressing treatment-resistant depression? A. Switching medications immediately. B. Increasing the dose of antidepressants. C. Reassessing the diagnosis and treatment plan. D. Starting electroconvulsive therapy, ECT. Answer. C. Reassessing the diagnosis and treatment plan. Question 2. What is the main goal of problem-solving therapy for a patient with depression? A. To help patients reframe negative thoughts. B. To develop practical solutions for external stresses. C. To focus on childhood trauma. D. To explore unconscious conflicts. Answer. B. To develop practical solutions for external stresses. Question 3. How often should follow-up appointments be scheduled for patients with resistant depression? A. Once every 3 to 6 months. B. Only after a relapse occurs. C. Every 6 to 8 weeks. D. Every 2 to 4 weeks initially. Answer. D. Every 2 to 4 weeks initially. Clinical Vignette 1. A 45-year-old patient has not responded to SSRIs or therapy for depression after 6 months. What is the most appropriate next step? A. Reassess the diagnosis and explore alternative therapies. B. Increase the antidepressant dose. C. Discontinue all medications. D. Refer to a psychiatrist immediately. Answer. A. Reassess the diagnosis and explore alternative therapies. Thanks for watching. I'll see you in the next video.